In this video, we will review high-yield cardiology cases focused on arrhythmias, volume physiology, and heart sounds. These concepts are essential for understanding clinical scenarios and improving your performance on medical exams. Let's get started with Case 1. Case 1. A 20-year-old man comes to the emergency department with chest heaviness and palpitations for the last 3 hours. Over the past year, he had a similar episode that resolved with deep breathing, but it did not last as long as this one. He does not use tobacco, alcohol, caffeine, or illicit drugs. Blood pressure is 100/70 millimeters of mercury, and pulse is 160 beats per minute and regular. The neck is supple, the thyroid is normal, and there is no lymphadenopathy. Electrocardiogram reveals a narrow QRS